So with the growing noise from parents since the Wakefield controversy, the governments and pharmaceutical companies felt that they needed to beef up the narrative a little bit on the supposed safety
Mm.
of vaccines. So these large scale studies, they're really useful for doing that because, well, from our perspective, the problem is that they're really easy to manipulate.
Mm.
Right, so they can decide how to allocate the research subjects into one group or another.
Okay.
And then if the results don't give the outcomes that they want, they can actually change the
Shuffle it.
groups. Yeah,
Oh,
right. And then rerun the analysis, and they can omit certain data or subjects for arbitrary reasons. And then there's a whole host of statistical methods that can be used to massage the data a little bit.
sure. Oh, wow. So there's a study that is very often cited, 2002 Madsen et al.
Yeah.
It's cited to establish vaccine safety and to debunk the autism link. So can you break that study down for us? What does it actually say? And conflicts of interest and all of that potential.
Yeah, okay. This one examined the medical records of over 500,000 Danish children between 1991 and 1998.
Okay.
So it basically compared the rates of autism in children who received the MMR vaccine and those who didn't. And so
Mhm.
the researchers found that the rates of autism in the two groups were almost identical.
Mhm.
So sounds very
Right.
straightforward, really large group studied, had the vaccine or not, case
Right.
closed.
Right.
But then if you dig into the details. So
Sure.
yeah, so firstly, the conflicts of interest. So who carried out the study?
Right.
So on that particular one, there were 8 researchers.
Mhm.
One of them actually worked for the US CDC, and the rest of them worked for this institution that kept receiving funding from the CDC, including for this particular study that they did. So the conflicts of interest were really clear. So just as a reminder, so the CDC is the one that sets the childhood vaccine schedule in the US, obviously. So they're under huge pressure to prove that the vaccine schedule is safe.
Mhm.
Another fun fact on the study is that lead author is actually wanted for fraud to this day.